Welcome to Unsung Heroes, the series where we celebrate the figures who changed the world from behind the scenes. Today, we're telling the story of Florence Nightingale, the woman who took a lamp and illuminated the dark corners of healthcare forever. Her name is legendary, but the true story of her relentless spirit is even more remarkable. From a young age, I knew I wasn't destined for the conventional life of a wealthy Victorian woman. While my family expected me to marry well and manage a household, I felt a different calling, a pull towards service that I couldn't ignore. Born into a privileged family in 1820, I received a classical education, studying mathematics, philosophy, and languages, but my heart was drawn to the suffering of others. I would secretly visit the sick in the nearby villages, providing what little comfort I could. My parents were horrified when I announced my intention to become a nurse. Back then, nursing was not a respected profession. Hospitals were dirty, disorganized places, and nurses were often untrained and had poor reputations. But I was determined. I believed it was my divine mission. After years of clashing with my family, I finally convinced them to let me pursue my training. I traveled to Germany in 1851 to study at the Institute of Protestant Deaconesses. It was a rigorous environment, but I absorbed everything I could about patient care, hygiene, and hospital administration. This was the foundation I needed. When I returned to London, I took a position as the superintendent of a hospital for mental women. I immediately started implementing changes, improving sanitation, and ensuring patients received proper nutrition and care. My reputation began to grow. I was proving that a well-run hospital could dramatically improve patient outcomes. Then, in 1854, everything changed. The Crimean War broke out, and horrifying reports began to flood back to Britain. Newspapers described soldiers dying in squalid, overcrowded hospitals, not from their battle wounds, but from diseases like cholera, typhus, and dysentery. The public was outraged. The Secretary of War, a friend of my family, knew of my work and asked me to lead a team of nurses to the military hospital in Scutari, Turkey. It was an unprecedented move, placing a woman in a position of authority within the army. I accepted without hesitation, gathering 38 volunteer nurses to join me on this daunting mission. When we arrived at the barrack hospital in Scutari, the conditions were worse than I could have ever imagined. The hospital was built on top of a massive sewer, and the stench was unbearable. Men lay on straw mats in their own filth, rodents scurried through the wards, and essential supplies like bandages and soap were scarce. There were no proper kitchens or laundries. More soldiers were dying from disease than from their injuries. The army doctors were resentful of our presence and initially refused our help. They saw us as unqualified female intruders in their domain. I knew I couldn't win by force. I had to lead by example. I started by getting on my hands and knees and scrubbing the floors myself. My nurses and I worked tirelessly, sometimes for 20 hours a day. We established a laundry to provide clean linens, set up a proper kitchen to cook nutritious food, and used my own funds to purchase necessary supplies. I was a formidable administrator, meticulously collecting data on mortality rates. My background in mathematics proved invaluable. I used statistics to prove that poor sanitation was the primary cause of death. At night, when the wards were dark and quiet, I would walk the long corridors alone, carrying my lamp. I spoke to the soldiers, wrote letters home for them, and offered comfort in their darkest hours. They started calling me the lady with the lamp. It was in these quiet moments that I truly connected with the men I was there to save. They saw that I cared, and that gave them hope. My reforms had a dramatic effect. Within 6 months of our arrival, the mortality rate at the Scutari hospital dropped from a staggering 42% to just 2%. My work was becoming legendary back home. The press hailed me as a national hero. When I returned to England after the war, I was famous, but I shunned the public spotlight. My mission was far from over. I knew that the problems I saw in the Crimea were not unique to the military. They existed in civilian hospitals all over Britain. Armed with my meticulously collected data, I launched a campaign for healthcare reform. I used my newfound influence to meet with Queen Victoria and Prince Albert, presenting them with my statistical evidence. My 830-page report, Notes on Matters Affecting the Health, Efficiency, and Hospital Administration of the British Army, led to the establishment of a Royal Commission. I invented a new type of chart, the polar area diagram, a kind of pie chart, to visually demonstrate how many more soldiers were dying from disease than in combat. It was a powerful tool that even the most stubborn politicians couldn't ignore. My work fundamentally changed the way the government approached public health. Sanitation, hygiene, and proper hospital design became national priorities. But I didn't stop there. In 1860, using funds donated by a grateful public, I established the Nightingale Training School for Nurses at St. Thomas Hospital in London. This was the first secular nursing school in the world. It was revolutionary. My vision was to transform nursing into a respectable, skilled profession for women. The curriculum was rigorous, emphasizing the importance of hygiene, observation, and compassionate care. Graduates of the Nightingale School went on to establish similar training programs across the globe, spreading my principles far and wide. I wrote a book called Notes on Nursing, What It Is and What It Is Not, which became a foundational text for the profession and was even popular with the general public for home healthcare. For the rest of my life, I continued my work from my home, often from my bed due to a chronic illness I contracted in the Crimea. But my mind remained as sharp as ever. I wrote thousands of letters and published over 200 books, reports, and pamphlets on hospital reform and public health. I advised governments from the United States to India on hospital construction and sanitation. My work laid the groundwork for modern evidence-based medicine. I showed the world that careful observation and statistical analysis were essential tools for improving health outcomes. I argued that a patient's environment was just as important as any medicine. Fresh air, clean water, good food, and a sanitary space were the cornerstones of healing. I lived to the age of 90, passing away in 1910. I had lived to see nursing become one of the most respected professions in the world. The girl who defied her family's expectations had become the founder of modern nursing. My legacy isn't just about a lamp in a dark corridor. It's in every clean hospital ward, in every dedicated nurse, and in the fundamental belief that every patient deserves dignity, compassion, and the best possible care. I proved that one person, armed with data, determination, and a deep sense of purpose, can truly change the world. Florence Nightingale's story is a powerful reminder that heroes aren't just found on the battlefield. They are found in the quiet corridors of hospitals, in the halls of government, and in the hearts of those who dedicate their lives to serving others. She was a true, unsung hero. Thank you for watching. If you found this story inspiring, please like this video and subscribe to our channel for more stories of the incredible people who shaped our world. We'll see you next time.